Thanks, Ryan. Well, this is the time of year where doctors often see an uptick in injuries, specifically involving the neck and the back. Whether it's lifting heavy boxes of decoration, shoveling snow, or falling on a slippery surface, the injury may need medical attention. And joining us now to explain is Dr. Gregory Kuzmik, neurosurgeon with Hartford HealthCare's Air Neuroscience Institute in Meriden and North Haven. Doctor, welcome.
Thank you for having me.
Great to have you. So what type of injuries can someone suffer from, whether it's heavy lifting or a fall this time of the year?
Yeah, one of the most common types of injuries that we see are injuries to the muscles or ligaments of the spine. So we term this a myofascial injury, and usually it results in pain right in the middle or just to the side of the neck or the back. Now, a more serious type of injury that can occur is a herniated disc. This can result in a pinched nerve, and typically this manifests as pain shooting into the arm or shooting into the legs. And then lastly, especially as we get into snow and ice season, it's important that everyone be cautious about avoiding a fall, potentially causing a fracture or dislocation on one of the bones of the spine.
All right, how can a person tell if it's an injury that won't go away on its own and needs medical intervention?
Thankfully, most of these injuries are minor and do resolve on their own over time. However, when someone has symptoms that persist for more than a week or two, or the symptoms are severe and constant even when someone is lying down, that's an indication that they need to get evaluated by a medical professional. Likewise, if someone is experiencing pain that's shooting into the arms or shooting to the legs, that's something that they should get checked out. And certainly if they experience any neurologic symptoms, weakness or numbness in the arms or the legs, that's a reason to seek immediate medical attention, because that can indicate a problem with the spinal cord or spinal nerves. Unfortunately, for some of these conditions, the longer the symptoms persist, the lower the chance of recovery. So it is very important that they get these evaluated in a timely manner.
All right, doctor, if someone comes in with an injury, what is the course of treatment typically?
The first line treatment for the majority of these conditions is actually non-surgical treatment. I tell people, even though I'm a surgeon, that's what I do, we really consider surgery to be the last resort for most of these issues. So usually we try and get someone's symptoms under control with a combination of medications or physical therapy. Sometimes a spinal injection may be an option. But when someone has symptoms that persist or worsen despite these treatments, that's when we start to consider the option for surgery.
All right, let's talk about prevention now. What would your advice be to someone to avoid being injured in the wintertime?
Yeah, one of the most important things people can do to avoid these types of injuries is to limit the amount of stress on their spine. So that means maintaining good spine ergonomics, a healthy posture. I think we've all heard that when you're lifting something heavy, it's important to lift with your knees and not with your back. The other thing I always tell people is it's important to maintain strong core muscles through exercise, because that helps stabilize the spine. Unfortunately, some of these injuries are unavoidable. They're just part of living life. So when someone does begin to experience some of the symptoms that we talked about, it is important that they get them evaluated. Some people are very stoic. They get used to living with back pain or neck pain, but that doesn't have to be the case.
All right.
So oftentimes, the sooner we can get these conditions treated, the better the chance for recovery.
Dr. Gregory Kuzmik, Hartford HealthCare neurosurgeon, thank you very much.
Thank you for having me. Stay safe out there.
And to you.